Welcome, everybody, to this month's presentation from the Transportation Equity Task Force. I'm super glad to see so many people are here, and I'm glad that you find this an interesting topic. I hope we live up to your expectations. Um, I'm Lisa Stedman, and I'm with the Transportation Equity Task Force, which is led by ABLE New Hampshire. This meeting is going to be recorded, and by being here in the recording and participating in the question and answer portion of the session, we'll take that as your permission to be in the recording, which is going to be posted on YouTube a little bit later on and also on the ABLE website. The audience is muted for a webinar style experience that might be a little different from what you're used to. It's not going to be interactive just at first, but you can use the chat throughout the meeting. And you can use the raise hand function if you want to be recognized when we do get to the interactive portion of the meeting. So at that time, let us know your name and the organization or role if it's applicable so we can know who we're talking to. Advocates Building Lasting Equality in New Hampshire, or ABLE New Hampshire as we know it, advocates for civil and human rights of children and adults with disabilities. We promote full participation by improving systems, connecting families, inspiring communities, and influencing public policy. Every year, ABLE reevaluates the task forces that it works on. And back in 2024, transportation equity was one of those task forces that was most wanted by the people that ABLE supports. So the task force was established and it went to work figuring out what it was going to work on. One of the primary projects of the task force is the Lunch and Learn series. We wanted to do these lunch and learns to help people with disabilities become aware of the many transportation options and resources that are out there, and to help them become comfortable using those tools to get where they need to go. And we understand that there are also people here supporting people with disabilities, and we appreciate that you're using these tools to do the same. Our next Lunch and Learn is going to happen on March 20th, and we're going to talk about ride sharing and the concept of ride share, how those programs get started, which programs exist in the state of New Hampshire, and how you can get involved. In April, we'll talk about travel training and how folks can be trained to use the different modes of transportation that are in their regions. And then on May 15th, we'll hear an update on one of our previous Lunch and Learns. That was the Medicaid Everyday Transportation waiver service option of non-medical transportation. I want to remind everybody that all of the Lunch and Learns that we do have an archive on the ABLE New Hampshire website. We do one-pagers for each, and we keep the recordings up there. So if you missed something that we've done in the past, please feel free to go to our archive and search up things there. We hope you find that useful. Today, we're going to talk about regional coordination councils. I'm a part of one. I find them to be very cool and helpful in the state of New Hampshire. It truly is where puzzles are solved. So I'm going to turn it over now to our first presenter. That's Steve Workman. And I'll let you take it from here, Steve.
Okay, let me get my slides up, everyone. It's good to be back. I was with you back in November to talk about mobility management. So again, everyone, my name is Steve Workman. I'm the Director of Transport New Hampshire. I also serve as the Secretary for the State Coordinating Council for Community Transportation. And in addition to that, I also am an adjunct instructor with the National Transit Institute at Rutgers University. And I've worked extensively with Federal Transit Administration and other national entities to provide technical service and to advance priorities and to try to remove barriers across the country. I'm happy to report that Federal Transit Administration looks as to New Hampshire as a leader. The innovative projects we've done in the past, including that mobility management network and how we've braided funding across state and federal agencies, they consider to be the shining example. I'm not kidding. That's their word. The shining example they have of how states can really more effectively stretch every dollar while improving outcomes. So that's pretty excited to know that how many of you have been a part of that story. So moving forward, just a brief outline today. So today I'm going to talk to you about why coordination matters, because both of these councils, they're all about coordination. So then I'm going to drill down into what is the State Coordinating Council and how does it impact your life? After that, my colleague Nate Miller will talk about the ABCs of the regional coordination councils and highlight some of the good things happening in his Region 8. Then my colleague Nick Altanaga will talk about the structure and meetings for a typical coordination council, and then he'll share some of the good things happening in Regions 1 and 2 of our state. And then I'm going to join you back in with sort of that final thought and call to action. What do we do with the information that you received today? So I want to start by saying some of what we have to talk to you today is really technical, or maybe it's just becomes a lot of words. And that could make you feel like this is too much for me. What I want to tell you is first, you're not alone. Every single one of my colleagues and I, when we started this work, it took a long time to learn and understand all the different parts of it and how to be there. But the point of these councils is to make sure that you have a place to go for your voice. So stick with us. We don't expect you to come out of this being experts on how to run these councils, but we are hoping that you understand the role they play and you understand how you can actually help us improve the system so that we can support every single one of us in this state who needs transportation services. So right now, if you can see the screen, there's a picture of an airplane on the tarmac at an airport. You might think, well, wait a minute. We're not here to talk about air travel. But I like to use this as an example. So if I was in the room with you, I might do this as an activity and we'd have a lot of talking about this. But the reason I'm showing you the airplane is I want you to think about something. How many different systems are needed to take a trip on an airplane? What makes it all work? And most of the time, because if you have taken a trip, I'm sure you've experienced your luggage ends up in Saskatchewan and you are in Australia. So those things happen. But the reason I do this is because so many systems have to take you on an airplane trip. So what do I mean by systems? Well, let's talk about it. So the first thing you do is you decide you want to go someplace and it's going to require an airplane. So you've got to figure out a ticket. So you use a ticketing online service, you pay for your ticket. The time of your trip arrives. Well, you're going to need to get to the airport. How are you going to do that? Well, if you're able to drive yourself, you may hop in your car. Then you're going to use a system of roads and bridges. But maybe you don't have a car, or maybe you don't want to take your car down into Logan Airport, for example, and have to drive through that traffic. So then you got to look for what sort of transportation services are out there that can get you from your home to that airport. That's another system. But when you arrive, there's more systems. Then you get into the ticket line and you check in and you check your bags and you make sure that's all correct. Then you go to the next system, which is where they do security checks and make sure that bad actors aren't getting on and nobody's hiding anything in their shoes or anything else that they should be. Then you go to the gate. That's another system while you're waiting there. There's folks that are getting ready to bring you onto the plane and make sure that you get on safely. Once you're on the plane, then another system takes over, and that is the folks that are operating the plane and making sure that your journey is good and you get there. And then the same thing happens on the other end. What happens if one of those systems breaks down? You're going to have a problem. But what makes them work most of the time? It's coordination. And that's why these councils and what we want to share with you today is so important. So it's all about coordination. This is a slide you use, and I'm going to describe it just in case you can't see my screen. So I have a big picture of a happy customer who happens to be using a wheelchair. Well, why is this customer happy? Well, I've got two other boxes there. The first one is kind of weird. It has this big box, but there are 4 different arrows going in every direction. And inside of it, there's these smaller arrows. And they're going all over the place, pointing in different directions. Well, that's what chaos looks like. That's what happens when you don't have coordination around these different systems. That means they're operating on their own and going in so many directions. Well, who gets left behind? We do. The consumers, the people that rely on these services to get where we need to go. So really what we try to do with coordination is the next box. Suddenly that big box with arrows going in all directions is now a single arrow pointing in one direction. Now, inside that arrow are those same solid little arrows. But here's the magic. They're now all pointing in the same direction. That's coordination. That's a shared vision and a shared mission. There's one more thing I got to talk about because we're Granite Staters, and that means we're independent. Notice in this diagram, when I talk about those small dark arrows, those arrows didn't have to give up who they were. So those arrows might be a bus company, they might be a volunteer driver program, they might be a regional coordination council, they may be a healthcare center. No one gave up their identity to work together. They're still doing their mission, their objectives, but they've decided it's more important that they work together in order to bring this about. So that's coordination. And now let's move into how the councils try to harness this idea of we're better together. So I'm going to talk to you about the council I serve on, which is the state coordinating for community transportation. So the general court established the state coordinating council and the regional coordination councils under Title 20 of the Transportation Chapter 239B. So FCC was established in July of 2007, and it came first. Once it was established, the FCC, along with many, many statewide partners, worked together to define what the regional coordination councils would look like and how the lines would be drawn on the map. Once that was organized, then the legislature came back in again and they officially established the regional coordination councils in July 17th of 2010. So you can see there was a process where it started with FCC taking that big statewide vision, recognizing that we can't have a single coordinated statewide system that works for everybody if we don't think about it in that big picture. However, the FCC can't do everything alone. It can't be everywhere at once. And that's why the regional coordination councils and their development was so critically important. So I mentioned that concept of a shared vision or shared mission. So I want to share both of those vision and missions that the state coordinating council and the regional coordination councils share. So our vision is New Hampshire envisions an integrated system of safe, reliable, and sustainable transportation options that allow residents to maintain independence and participate in work and community life no matter their age or ability. So what does this look like for a shared mission then? Well, the mission of the FCC and the RCCs is to improve the coordination, capacity, accessibility, quality, and sustainability of mobility options throughout the state of New Hampshire. That's a lot of work. It's a big vision, but we have to do it. So we have a guiding philosophy that helps the state coordinating council do its work, and then it dovetails into value. So I want to share that with you. So the FCC encourages organizations and individuals like you from across the state to attend meetings and engage with members to positively impact community transportation services in New Hampshire. The FCC values the participation and input of community members and users, as well as representatives from groups, including but not limited to transportation agencies, local and county government, planning commissions, human service providers, economic and workforce-related agencies, and stakeholder advocacy organizations such as ABLE. There is a place and a need at our table for every single one of you. I've got 2 slides now that talk about our duties that are assigned through our bylaws and the state statute. And there's an example of a lot of that text crammed onto a screen. So I know that these are going to be shared with you. So if you want to study this more, you're going to be able to read this in more detail, but I'm going to highlight a couple of these so you understand. And unfortunately, I'm going to read, but it's important that I get the message across. So our duty is to develop, implement, and provide guidance for the coordination of community transportation options within New Hampshire, so that the general public, in particular citizens in need of access to essential services and activities, can access local and regional transportation services and municipalities. Human service agencies and other organizations can purchase shared ride coordinated transportation services for their citizens, clients, and customers. So we set statewide coordination policies for community transportation. We approved the formation of the regional coordination councils, which is something historically that has happened, but we continue to evolve and grow so that we can better face the needs of New Hampshire residents. So we continually look at this structure and figure out where we need to make changes. We have the ability to solicit and accept donations or funding to implement and sustain our community transportation services in the state. We collaborate and support regional coordination councils in the delivery of community transportation services, and we oversee the deposit of all donations in accordance with its statutory duties to help develop, implement, and provide guidance for the coordination community transportation. The SCC, with input from the RCCs and advice and consent of New Hampshire DOT, will take the lead in developing, implementing, and maintaining the New Hampshire Mobility Management Network, which is something I know is going to be talked about briefly during the rest of this presentation, but also we refer you back to the ABLE archives when we talked about the Mobility Management Network back in November. So with that, I'm going to stop sharing and I'm going to turn it over to my colleague, Nate Miller, who's going to bring us into those ABCs of a regional coordination council.
Well, good afternoon, everyone. As Steve mentioned, my name is Nate Miller. I am the Deputy Director of the Southern New Hampshire Planning Commission, which is the lead agency that serves the Region 8 Coordinating Council. And Region 8 is the greater Manchester, Derry, and Salem area in the southern part of the state. So over the next few minutes, what I'm going to walk through are sort of the what I call the ABCs of RCCs, which is really the duties and responsibilities of regional coordinating councils, essentially what we do as RCCs, and highlight some real life examples here from the Region 8 area that reflect some of the activities that are happening. So we'll start with the legislative authorities of regional coordinating councils. So if you looked up state law, and the governing state law here is RSA 239B, you would find a section related to regional coordinating councils. And there are three primary responsibilities: facilitate the implementation of coordinated community transportation in their region. That's a big charge, and we'll talk more about what that means in a minute. 2, encourage the development of improved and expanded regional community transportation services, another big charge. And then 3, advise the state coordinating council on the status of community transportation in their region. I'm going to focus on number 1. What does it mean to implement coordinated community transportation? And I think of this really in 2 ways. Coordination means eliminating redundancies and filling gaps. We want to make the highest and best use of our limited transportation funding resources in New Hampshire and in each of the regions. So to do that, it would be not a prudent use of our funds to fund duplicative services, services that do the same thing or serve the same population group. We want to fill gaps where they exist and reduce redundancies. And then also continually look at ways of improving and expanding the transportation services that are available within our respective regions, that number 2 bullet. Big charge. How do we facilitate the implementation of community transportation in the region? Well, if you're familiar with regional coordinating councils, probably the thing that we are most known for is administering and deploying Federal Transit Administration Section 5310 funding. That is a federal funding source that exists to support, and it's quoted here, the transportation needs of older adults and people with disabilities. So older adults and people with disabilities when the transportation service provided is unavailable, insufficient, or inappropriate to meeting those needs. So again, we're not looking to duplicate transportation services that exist and work. We are looking to build upon those, improve upon those, expand upon those services when they are necessary to meet the specific needs of older adults and people with disabilities. And so the way that funding flows, this is, again, it's FTA funding, Federal Transit Administration funding, it's federal. And so New Hampshire DOT, as a state agency, is the state pass-through entity for that federal funding. And this is kind of the diagram on the left. New Hampshire DOT enters into a contract with a lead agency. Lead agencies are selected by each of their respective regional coordinating councils. They are responsible to New Hampshire DOT. And then each of those lead agencies passes through that funding to a set of what we call second-tier subrecipients. So those, generally speaking, are transit agencies or volunteer driver programs that actually deploy transit service and provide rides. And so the funding, again, flows from New Hampshire DOT to the Regional Coordinating Council lead agencies to those transit subrecipients. How does funding get distributed to regional coordinating councils? It's a question we get asked very often. New Hampshire DOT has a formula for how they distribute that Section 5310 funding to each of the regions in the state, and it is based on 3 factors. Each region's proportionate share of seniors and persons with disabilities. This is actually drawn from census data for each of these regions. How many seniors and people with disabilities live in each of these regions? Now, there is an adjustment that now occurs for the Nashua urbanized area, which is I don't want to get too in the weeds, but a specialized census designation. There is a separate set of funding that goes directly to the Nashua urbanized area to support some of 5310 funding. But in general, it's census data that is crunched in each of these regions that is used to determine the population of seniors and persons with disabilities. There's a second factor that's been added now to look at each region's proportionate share of roadway lane miles and land area. This is an effort to ensure that distribution to rural regions is equitable. And so there are fewer people in the North Country, for instance, but a lot more land area, and it's more challenging in some cases, as Nick will talk about in a little while, to deliver transportation services across a wide rural area with a lot of topography challenges. So this point in number 2 helps to make that distribution equitable for the rural regions of the state. And then third, there is a set aside that is the same amount of money for each of the regions in the state that supports the work of regional mobility managers. And I know that you've had a previous Lunch and Learn focused specifically on the work of regional mobility managers back in November, I believe. Now, I would be remiss in not mentioning that there are compliance factors at play. Anytime we're dealing with federal funding comes with strings attached, and those strings can be complicated in the world of transportation. This image on the left is actually a table of contents from a 5310 compliance review that my RCC had to complete last year. There are 17 different categories of compliance to be reviewed. It's a lot, and it's a lot for the lead agencies to make sure that all of the activities are happening in coordination, in accordance with federal guidelines, federal rules, and that we're meeting all of our statutory requirements to use federal funding. It can be a challenge sometimes for small organizations, particularly small volunteer driver programs, to have the administrative capacity to manage federal funding. We've had a small volunteer driver program in our Region 8 region that we would like to pass some funding through to. In a perfect world, we would be able to do that to support volunteer driver recruitment and efforts within their agency. However, they don't conduct an audit each year. And so it costs money to conduct an audit. It costs money for them to develop a Title VI program. All of the things that we have to do as a matter of administering federal funding is a cost burden for small agencies that may not have the staffing capacity to do so. So it's not necessarily, right for every organization, but we try to be as creative as possible in figuring out how to meet the needs of the region while ensuring all of these complex compliance requirements are met. And I'll give a quick example We have a community in Region 8. Some of you on the webinar today may be familiar with. It is the town of Deerfield. It is east of Manchester, sort of in between Manchester and Concord and the seacoast. And it's a town that did not have any transportation service or any active volunteer driver program. It was a gap. I talked earlier about filling gaps. Well, the town of Deerfield was a gap in our transportation service network. And we looked hard at how to best fill that gap. And it turns out that the best way of filling that gap for us was to work with a volunteer driver program in the Seacoast called Ready Rides that had the ability to expand their service coverage to the town of Deerfield. Now, Ready Rides is not a subrecipient of the Region 8 Coordinating Council. They're not one of our subrecipients. And we didn't want to create an administrative burden or a compliance burden on anybody to try to fill this gap in Deerfield. So what we ended up doing is making an agreement with our colleagues in Region 10, the Seacoast region of the state, where we actually pass some of our Region 8 funding to Region 10 because Ready Rides is already a subrecipient of Region 10. And in exchange for that transferred funding, Ready Rides has now extended their service area to serve the town of Deerfield. So we worked together to ensure that all the compliance needs were met, but not create any necessary additional burdens on either us as lead agencies or Ready Rides as a subrecipient. And so these are the types of challenges that we at the regional level are working through constantly, and we need to be creative to do that. And fortunately, we have great partners at New Hampshire DOT that work with us and help make these things happen as well. How do regional coordinating councils determine project priorities? In other words, how do you decide what to fund at a regional coordinating council level with your Section 5310 funding? Well, a lot of it is we get ideas from a lot of different groups. We hear transportation needs from the transit providers themselves. We hear it from our municipalities. We hear it from advocacy groups. We hear it from the general public. And a lot of what we hear gets synthesized into the regional coordination plan. So on the left here, this image is the cover page of the regional coordination plan for our region, the Region 8 area, Manchester, Derry, and Salem. But every regional coordinating council has a regional coordination plan, and that lays out their priorities and what they define to be success. And each region is a little bit different in what their unique needs are and what their priorities are. But in general, everything that gets funded at the regional coordinating council level has a basis in the regional coordination plan. And typically, those plans are updated every 5 years. Again, that idea of definition of success, what does it mean to be successful? How do you know if you've done well deploying Section 5310 funding? How do you know if you're making the highest and best use of that funding? And these are discussions that we have at our regional council level all of the time. There are different definitions of success. One definition might be to provide as many rides as possible. If we provide as many rides as possible, then we're successful. Another definition might be to provide as much coverage as possible. In other words, to make sure that services exist to cover as broad a population as possible or as broad a geographic area as possible. We try to balance those within our region. There's no right or wrong answer of the best way of deploying funding, but we, at least in Region 8 in recent years, have made a concerted effort to try to ensure that all of the communities of our region have some level of coverage, either through a volunteer driver program or through transit services directly. We're making progress on that front, but we've still got a ways to go. I don't expect anybody to read the text on this slide, but this is actually our program of projects in Region 8 for the current 2 fiscal years. So fiscal year 2026 and 2027, which we're in right now. And what this shows, and again, I don't expect everybody to read this, is that Region 8 passes through their funding to support 10 different activities, unique activities across the region through 4 different subrecipient agencies. So we have subrecipients: Manchester Transit Authority, Easter Seals, Rockingham Nutrition Meals on Wheels, and Catholic Charities are the 4 subrecipients that help us deliver these 10 activities. And these activities include transit services like shuttle services in the towns of Goffstown and Hooksett. These are communities that we had previously identified as gaps. These are their only options, are these shuttle services that are funded through the Regional Coordinating Council efforts. We have Rockingham Nutrition Meals on Wheels providing rides in and around the Vic Geary Center in the town of Plastow, another gap for us. We have Easter Seals providing demand response rides in sort of a ring of communities around the city of Manchester that fill a variety of gaps in our region. And then we have Catholic Charities through their Caregivers program. We support the recruitment of volunteer drivers. So you may hear radio ads about volunteer driver recruitment. You may see billboards, magazine advertisements. Those efforts to recruit new volunteer drivers are funded through the Regional Coordinating Council in Region 8. I won't spend too much time talking about regional mobility management today because you did have a previous lunch and learn on this topic in November, but it goes without saying that the work of the regional mobility managers is absolutely essential to the good function of each regional coordinating council. And each regional coordinating council kind of helps to shape the regional mobility manager's work plan and activities. And so in our region, we do a lot of outreach. We're constantly working to bring new people, new agencies, new organizations to the table at the RCC level to build sort of this coalition of groups that are all working, as Steve mentioned, in the same direction to build and improve our transportation services in the region. On that idea of transportation outreach, which we do a lot of in Region 8, all of the things that I have listed on this slide are things that we do in Region 8. We do brochures. You see an image of the back of one of our brochures on the left side of this slide. We do posters and flyers to help spread the word about the shuttle services that we support in Goffstown and Hooksett and elsewhere. Our mobility manager, Ben Herbert, does a regional newsletter about what's happening in our region in terms of transportation services. We've done educational videos explaining what RCCs do, what regional mobility managers do, what rides are or what services are available in the region for transportation. We've done public surveys, and those public surveys have helped shape where we invest our funds. So, for instance, we did a public survey in the town of Ware that demonstrated the need, another gap. We didn't have any service in the town of Ware, but through that survey, we helped demonstrate the need to extend volunteer driver program services into that community. And I'm happy to say that we did so successfully through another partnership with an agency in the southwest part of the state. So we've worked kind of through that model of partnering with other regions when it makes sense and are continuing to do that. And public surveys have helped shape that work. We work on travel training, and I'll show an example of just a minute of travel training. As Lisa mentioned, I believe you have a lunch and learn coming up about travel training initiatives in April, but that is really teaching people how to use transit services, how to read a bus schedule, how to get on a bus and get off a bus, and sort of the mechanics of how to be a bus rider. And then we do targeted presentations to a variety of groups, including municipalities, municipal boards, and even large apartment tenant associations we've been to. Last, I want to close with just an example of kind of rewarding success, a rewarding feeling for us in Region 8. Our staff, including our regional mobility manager, worked to provide travel training to a refugee group in Manchester called Victory Women of Vision. These women are from different parts of the world. They came here as refugees. Many don't speak English. And so we work directly with them and with our partners at the MTA to help this group learn how to navigate the bus system, learn how to read a bus schedule. All of that can be pretty overwhelming for people who haven't done this before. And so we kind of provided hands-on assistance, what we call travel training, to this group to help them get comfortable riding the bus and overcoming those language barriers. We're really proud of that work, and we continue to try to find more ways of conducting outreach across our region to non-traditional partners. So with that, I've probably gone long enough. I will stop sharing now. But that's a kind of a broad overview of what regional coordinating councils do. And at this point, I will hand it off to my colleague, Nick Altanaga from the North Country, to talk a little bit about how regional coordinating councils are comprised and how you might be able to get involved.
Thank you, Nate, so much for that background, really in depth. And so my name is Nick Altanaga, as Nate said and was said earlier. I'm the senior planner at the North Country Council Regional Planning Commission, and I am also the secretary for both Region 1, Grafton COAS RCC, and Region 2, the Carroll County RCC. I've been involved with these RCCs on and off for about 10 years almost. So I've been on the ground working with this, just like Steve and Nate, for a very long time. I'm going to run down a little, some details on RCCs and the meetings and who's involved with them. So generally, each RCC has a set of bylaws that establish, the different rules for the meetings and the membership, who's invited, who we want to join, what our goals are for that. Anyone who's interested in, becoming an official member would sign a memorandum of understanding, an MOU, and they can be official voting and kind of count towards, those official discussions. We always invite people to come as guests to see kind of what it's all about, to provide input. It's always really important, but if they want to be official and on the record, they can sign that MOU to join as an official rep. RCCs generally have 3 kind of officers involved: a chair, a vice chair, and a secretary that help lead the meetings. RCC meetings generally meet quarterly, so it's not some weekly or monthly thing. It's quarterly, kind of 4 times a year. Generally, one of the biggest discussion items we have are those 5310 funds that Nate described as federal funds. That's a big point of a big important point we have to talk about, of how those are split, what are our priorities for the year, things like that. I always, as the secretary, I help the chairs with the agenda and running the meetings. And my goal in our 2 regions in the northern part of the state is to kind of remind people that, we're volunteering our time to attend these meetings, and, we want them to be as useful and helpful to everyone. We're taking up time, we're taking up space. We want to make sure that people get the help they need. They can communicate their needs to the group and work together on solutions. So a big piece that I find important, just in general for the RCCs, is the conversations and collaboration we can do. These are important venues to talk about, concerns that different providers or representatives have, challenges that are going on with their client base, who they're working with, their staff, things like that. Really working together to, form new programs and filling gaps in services they might find. And also, sharing stories, successes, things, bright spots of that they have, of things that went well, so that maybe other providers and other members can replicate that or expand it. Each RCC region is unique and will have its own quirks and issues. RCC regions 1 and 2 were very rural, being the northern kind of third of the state. And one thing that we regularly grapple with are very long distance trips. As Nate mentioned, with how those federal funds are separated out, there's an effort to try and kind of change up how they're apportioned. so that we can work with that long distance. That's a really big challenge for us of finding drivers that are able to do that, and have it be worth our time and efforts. It just is sometimes it can be really difficult to meet that need. We have a big lack of volunteers and sometimes even paid staff drivers. It can be really tough up in our region. And also just in general, the geography that our regions, and I know a number of other regions, have to grapple with of getting around the, mountains, forests. We have a lot of, federal and state land that have to cut through, and there's the weather component as well. So it's really important to have these conversations and to work together to try and solve them, especially. And so some of the members that, we try and involve, day one is, transportation providers are, really the backbone of the group. And those can be transit agencies, fixed route services, deviated route buses that can help pick people up, the volunteer driver programs that, they volunteer their time and they get a little reimbursement for each trip to help make that work. Senior centers are really important. We have a couple of regional senior centers, especially, the Grafton County Senior Citizens Council. They've got multiple locations and they do great work serving just all of Grafton County. We've got the Gibson Center up in North Conway. They really do awesome work as well. And other providers that kind of fit in. We have some new people kind of contacting us. I want to do some not emergency transportation, and we invite them to the group to try and fit them into our ecosystem. And it's always great to have, but it's really a big, and that's every region, is that we're a patchwork of different types of providers. And over time, one of the big things that we've done in the North Country is try to expand as much to other sectors, groups, and locations in our regions of getting those voices. So we've had, counties and municipalities at the table. Human services are vital, members now, economic development agencies, public health, caregiver groups, and like I said, here is also senior centers again. We've had, the Coalition for Public Health in Carroll County has been a key member. We've got age-friendly communities. There were these alternative groups. And it's important that these, I love having these people at the table because, it brings new ideas and new energy to the group. We've really expanded, especially in Carroll County, to have hospitals at the table, adult education groups, an adult day center for special needs clients that are adults. And even recently, the Carroll County Department of Corrections, the jail system, has joined the table, and that's yielded some really interesting work and really helpful work for both incarcerated individuals and then planning for them returning to kind of regular life when they get out of the jail is really important. And so some recent, successes and collaboration work that we've done in the North Country is, that diverse membership has brought up really new conversations and collaboration. New supports are kind of going in. We're filling gaps where we weren't before. And really some important work over the past few years that we've done is that in Carroll County, they established a bicycle repair program and a bicycle co-op to help people get around the Mount Washington Valley, but also elsewhere in Carroll County. That's been great for just everyone, both visitors. There's some seasonal workers that have taken use of that program, and locals, obviously. And people they've loved it. It's been super helpful for those people that can't drive. They can get a bicycle, and I know it's not a perfect solution, but it has really filled a gap. We established a bicycle technician training program and a bike donation program at the Carroll County Jail. So it helps train inmates to fix bicycles, and then they get a certificate of completion so they can use that to help get a job when they return just to regular life. And they also are able to get a bicycle because many times their transportation situation is not great, so it gives them one other option when they get home to get around and make that happen. Up in the Upper Connecticut Valley Hospital in Colebrook, they worked with Tri-County Community Action Program Transit to establish a non-emergency medical transportation program to get clients to and from appointments. And it was wildly successful. And they had hundreds and hundreds of people each month being able to make appointments and, keep them. So that leads to better health outcomes and just, better quality of life for people. And, we've also had, public health and, transit agencies work together to help, do seasonal meal programs in the summertime. When, kids aren't at school, they had a few events that were able to give out meals to families and especially those students. When they don't have that regular lunch program, it's been, we've had a lot of other really good conversations about public health, about adult education, and just even talking about substance abuse programs that we've had involved at the table as well. Just wanted to bring that back, is that these are really good forums to, talk about the challenges that you're facing, whether it's an organization or an individual. And then having that conversation of, okay, how can we meet that need and fix that and expand on it? So yeah, there's a lot of good work going on. It's a lot of challenges, but a lot of opportunities. And now I'll return it to Steve.
So I'm going to bounce between two slides, but the slides aren't particularly important. What I'm trying to do is wrap up what we've done today. So right now, first, I want to tell you that I am putting my Transport New Hampshire hat on. I'm not speaking as a member of the state coordinating council or the regional councils. That is a role that I fill. And in that role, Transport New Hampshire serves in advocacy. So right now, I want to bring it down to the advocacy level. And that means sometimes tough conversations. But I want to remind everybody that I know for a fact this morning that you received an email from Lisa where she asked all of you to bring your very best advocate. And by the way, that includes you, not just that advocate for you. Maybe it's a parent, maybe it's a friend, maybe it's a social worker. Who knows? We need everybody to be able to talk about this. So I started my part of the presentation telling you about systems and trying to get you to see how a lot of different systems have to oftentimes work together in order to accomplish one goal for somebody. So in the airplane thing, to get you from your home to where you want to go visit and back home again. So the thing about systems is they don't work well unless we invest our time, our equity in them. And this is why we actually need your voice and to understand your lived experience. One of the things I learned quickly the deeper I went into this work and I met so many of our wonderful communities in New Hampshire is a saying, and that's the nothing about us without us. That's not a bumper sticker, is it? No, that is a call to action. We need to have you plug into our community transportation systems, because if you don't, we are not going to understand as well what it is like for you to live your day-to-day life and how to access our services. We cannot fix what we don't know about. Now, both of these councils, both types, the state and the coordinate and the regional, are designed to actually try to find barriers. So Nate talked about all of the important rules and regulations that make this very complicated work. But it doesn't stop there, because sometimes we have to figure out, okay, here's what the rule is, but how do we make necessary change so that we can improve? So this is one of those areas where I'm going to jump over to another slide, and then I'll come back to this one. And so the slide I have up right now, I've called it Systemic Barriers to Identify and Correct. This is what happens when those systems don't work well together, and why you and I, whether we're professionals, whether we're advocates, or whether we're consumers, have to invest our time and energy to look honestly at our systems in order to make them better. So sometimes when systems start humming along, there's a tendency to remain in a silo. You never think about what's happening around you. You just focus on your day-to-day. Oftentimes we find a resistance to change because we've been doing something this way forever. Sometimes it's a lack of resources, money, time, and people. And I will tell you that we have a lack of money and drivers in New Hampshire that we have to address. Sometimes systems can fragment And we adopt this go it alone mentality. Well, at the beginning, we talked about how systems have to work together. And in fact, you and I are better together. There's an abandonment of effort without giving it time to mature. You know, some of these, let's say you start a new bus route. It may take a year or two for that bus route to show the numbers that you actually want to see to say, hey, this is important. If we don't allow that time to mature, there's going to be challenges, or we're going to get rid of things that actually could have made a difference. A lot of times there's misunderstanding around rules and regulations, or someone is believing that they can never be changed. Policies and laws are meant to be changed. We have another system and a process for doing that. But if we don't show up in Concord and speak to our legislative reps, and if we don't speak to our representatives at the federal government, these things won't be changed. They won't know that something's not working for you. Risk adverse, to avoid potential failure. No one likes to fail. And believe me, for those of us that do this as a job, we're even like, oh man, I don't want to get in trouble. I'm doing my very best. But sometimes our best doesn't always work out. Some people can be worried that if they open their mouth, there's going to be retribution. Oh, am I going to lose my funding? Or will people not like me anymore? Will I not get invited back to the table? Sometimes it's poor communication. Sometimes difficult group dynamics. We're all people. We show up every day with everything that has happened in our life. Maybe we've had a really tough day and we're in a meeting, we're not feeling great. Maybe the challenges is so overwhelming. We have to work through those things. And then it's critically important the decision makers are not rejecting or ignoring stakeholder input and suggestions. That only happens if stakeholders and consumers are at the table. So you want to make sure that you plug in and you learn about the systems, you understand their limitations and barriers, because just as Nate taught us today, there are rules and regulations, and sometimes even our mobility managers have to say, I'm so sorry, we cannot solve this problem for you. Maybe it's because there's a gap in services. Maybe it's because we don't have enough money. Maybe it's just something that's out of our control. We can speak that truth, but that doesn't mean that we have to accept it and not work toward change. So these systems are are necessary and important. Do not let them lead the show. And you can do this work. You can be an advocate. You can come to the regional coordination tables. And regardless of whether you don't understand much of what we talked about tonight, you know what your life is like. You know what you need and what your experiences are. That's your value. That's how you become a valuable part of this. I know there are folks on this call. I'm going to call my friend out, Andrew Harmon, who I think might be on this call. I have sat with him in the governor's executive council chambers, and I listened to Andrew talk about what his life is like using our community transportation systems as a person with low vision. And he said this to two sitting executive counselors. Wow, that takes bravery. That is not easy to do. But that is actually exactly what our system is designed to do. We are a democracy. If we don't interact, if we don't insist that people hear about our challenges and make changes that are going to bring us what we need, no one else is going to do it. We have to be those voices out there. It's also critically important because if you take this up a level, we need our state agencies to work together better. So something you may not know is that New Hampshire DOT doesn't get the most transportation dollars from the federal government. Now that might make you go, are you kidding? No, it's true, at least for community services. It's actually the Department of Health and Human Services that gets more funding for different types of transportation services. So that means right away, those two state agencies have to find a way to work together. And then that trickles down to our councils. And then that trickles down to the providers. A bus is a bus. There is no reason that we can't find more effective ways to use those buses optimally and accomplish the goal of all those little individual silos that get woven together. So there's a lot of good things. And Nate and Nick both highlighted some incredible things happening in those regions. And that's what I want you to focus on. The negative stuff, the barriers, yes, we have to work through those. But do not forget that you have made a difference, and my colleagues who work so incredibly hard have made a difference. We have big barriers. Right now, where you live, it may not be possible for you to go from your home to a medical appointment that maybe is in another state. So we know the challenges are there. Together, we can actually come together and make a difference. Remember, nothing about us without us. Thank you so much for taking time. Lisa, I will turn it back over to you.
All right, and with just a couple minutes remaining, I want to share with you a few more slides, and then we'll move into question and answer. Don't worry, we will get to those questions and answers. I have to beat this drum. Remember, if you have questions about this topic, you can always go to your regional mobility manager. Please do. They're the ones who can help you understand what we've just discussed here and to get you back to the resources that we've mentioned. Here is a QR code for the closing survey. There are a couple of reasons why it's really important for us to get you to fill this out. We need your name to get you on any notifications in the future and to send you the recording of this in the summary. You won't get it unless you fill out the survey. Also, we need to know who our audience is. We need to know that we're talking to the right people. We want to hear from you about the topics that you want to see and what else you need. And we also, of course, want to know how we did. So if you're multitasking, you're doing this while we go through question and answer, I'm going to give you an opportunity, and I'll come back to this slide in just a minute. But first, I have to say that we do have another Lunch and Learn coming up on May 20th. The next one is about ride sharing. And ABLE New Hampshire is an organization that's supported by donations and grants, and most importantly, its members. If you're interested in becoming a member of ABLE and supporting its work, please do. There are lots of ways that you can get to the website and to become a member. We really appreciate you. I know Creighton, who is our current staff support and is on this Lunch and Learn with us, really appreciates that too. So thank you very much for being here. And at this time, we're going to start to relax all of the controls so that folks can answer questions and start to ask questions. All right, Andrew, get us started while I take care of the controls for everyone.
I just want to mention number one, thanks for that shout out, Steve. My face was burning. Two, if anybody is uncertain what region you're in for your RCC, there's an amazing website you can go to that Steve helps run called Keep New Hampshire Moving. That's KEEPNHMOVING.com. And then there's a control near the top that says regions. Just click on that or use your screen reader to go there, and you can find all your regions by town. Thank you for putting this together.
Of course. Any other questions from folks? You guys have pretty much said it all. I do want to ask just a couple of questions that we planned ahead of time. I'm sure people are wondering, how do they get to their RCC meetings? Do they have to have transportation to get to these meetings about not having transportation? Anyone? One of you?
I'll jump in to say that both the state coordinating council and the regional coordination councils are public bodies. As a result of that, we are required to make reasonable accommodations so that you can attend those meetings. Now, having said that, transportation to those meetings are still part of the challenges that we face. And so the same services that you are liable to access on a day-to-day basis may actually be the ones that you can take advantage of to attend one of these meetings. I know that there are times when all of us roll up our sleeves and try to make sure that we are able to move advocates between these meetings to the extent that we can. I'll defer to my other colleagues if they have another sort of idea.
I can tell you that all of the RCC meetings do have a virtual option to them. Some of the virtual options, you'll actually have to receive the agenda from one of the secretaries just because they have been hacked in the past. So if you are interested, the event calendar on Keep New Hampshire Moving does post when the RCC meetings are happening, but you may have to reach out to that contact person for the actual link to the meeting.
Well, I want to follow up on what Terry said. I know in Region 7, we have a distribution list where if anyone's interested, they can get on our distribution list and you'll get an email with information about the meeting, the agenda, and the link for the hybrid. So that's another option if you are unable to get a ride. So we do try to locate our meetings in a central place that has access to public transportation, is also served by our local volunteer driver program.
What do I do if I think my agency should be involved in my local RCC? How do I get started?
I would recommend contacting the mobility manager for your region and talking with the mobility manager and actually coming to a future RCC meeting or maybe the next RCC meeting on the calendar. We always welcome new faces here in Region 8, and I'm sure my colleagues around the state do as well. I think that would be a very good first step for people to maybe make a phone call or send an email to the regional mobility manager in their respective area and just introduce yourself and your organization and have a chat with them and learn about how and when to potentially come and participate in an RCC meeting.
So the mobility manager is really the key to finding out when they meet and where they're meeting, how to get the link to the meeting, all that good stuff, right?
I think it's a wonderful first point of contact for people.
Okay.
Now, in the North Country, we don't have, currently our two regions don't have mobility managers, but, you know, if you contact Steve or, you know, like the planners like me or other colleagues, you know, we're always able to direct people. I basically run our two regions. So, you know, there's a lot of support that goes into the RCCs. So, you know, using Keep New Hampshire Moving, like Andrew had mentioned earlier, is a great way to kind of connect the dots and get in touch with either the mobility managers or the other help that helps run the meetings themselves. Also, if anyone wants to be a mobility manager, we can talk.
All right, Janet, back to you.
Yeah, I just might also suggest that if people can get out to the Keep New Hampshire Moving website, there are pages for each of the RCCs, and those include lists of the organizations that are members. And it may be that you already know a member and might want to pick their brain about what your RCC is doing and how to get involved. And that may be another point of contact and way to get involved.
Good. Well, it usually comes up what happened to the other two regions. I think they're Region 4 and Region 9, is it? They got combined with existing regions because those regions are built around hospitals and social services and where people are headed to receive their services. So coordination just made sense to combine a couple of the regions together. Any other questions before we break? Andrew.
I have an actual question this time. Does anyone have a good suggestion for the advocacy piece if you have a conversation with a legislator or an executive counselor or someone who is in charge of the funds and they seem really nice, they seem really interested, but they don't really want to go anywhere with it? Does anyone have like a suggestion for what the next piece is?
Andrew, I have one thought, and that is it's really important to know when people are having that type of contact with legislative reps. So any opportunity to loop us in, and specifically Transport New Hampshire because of the advocacy component, I'm very interested in learning about what your experience is like if you bring up an issue. We are not able to figure out that that's happening unless somebody informs us. But when you do that, then that means folks like myself and my colleagues, not only can we bring it to our regional meetings or our state coordinating council, but we can connect other dots with our fellow advocates that really help us and support us, because we spend a lot of time behind the scenes actually trying to build relationships with other providers and agencies, but at the top, the decision makers, the legislative members and things. So we need to know what's happening out there.
Okay.
Donna?
Oh, so thank you. And very good today. It was very enjoyable. I just want to mention to Andrew the question about if you meet a state legislator. One of the things that I find is very useful is if it's your state legislator, they know that you're going to be there for them later on down the road. So I think that's always helpful. Or if they're really pushing back on it, try to find a key person in their district that would be interested in it and have them approach the person, because a lot of politics is local. And if they feel like they're going to get support later on down the road, they'd be more likely to help you. So that's just my sense, Andrew, but that's a good question. Thank you.
Good. I think we'll wrap up for the day. I'm going to go ahead and turn off the recording. If somebody wants to hang out for just some very casual conversation, that's all good. And also, I would ask for the presenters to stick around so we can look at some of our early feedback.